So here we have test question. Pause the video, take a few minutes, read this test, guess which answer is correct, and after let's discuss this test step by step. So it's 62-year-old woman. For 3 months she complains on fatigue, dizziness, tingling sensation in her feet and her legs feel weak. She is on vegetarian diet for 2 years. From her anamnesis, we know that she has autoimmune hypothyroidism, for which she takes levothyroxine. Her skin is pale, she has decreased sensitivity to light touch and decreased vibration sense, which tell us about neural injury. Also, she has positive Romberg sign, which means that she loses balance with closed eyes. Positive Romberg sign tell us about affected proprioception. Her tongue is smooth and red, which is a common feature of megaloblastic anemia. She has anemic signs and she has neurological symptoms. Her hemoglobin is 68, which is low. Low hemoglobin we call anemia, and we know that anemia classified based on severity and the size of red blood cells. To determine severity of anemia, we have to know two numbers. It's 110 and 80. Also in this case it's a woman, and the lower limit of normal of hemoglobin in women is 120. So from 120 to 110 is mild anemia, from 110 to 80 moderate, and lower than 80 is severe. In this case, hemoglobin is 68, so it's severe anemia. The type of anemia we determined by the size of red blood cells, and to determine the size of red blood cells, we look at MCV. In case of MCV, we have to know two numbers. It's 100 and 80. Everything about 100 is macrocytic, between 100 and 80 normocytic, and lower than 80 is microcytic. In this case, MCV is 115, which is macrocytic anemia. When we see macrocytic anemia, we have two options, B12 or folate deficiency. In this case, we know that she has low B12 level. But even without this data, we could say this. Both B12 and folate have the same feature. They both cause decrease in DNA production, which leads to inhibition of hematopoiesis and results in macrocytic anemia. But also sometimes it can cause decrease in white blood cells and platelets. But unlike folate, B12 deficiency affects neural system. So neurological symptoms we can see only in B12 deficiency. In this case, patient has tingling sensation in her feet and legs feel weak. Also she has a number of neurological symptoms. The question is, what is the cause of her B12 deficiency? Is this diet or no? And to solve this test, we have to look at time frame. She was vegetarian for only 2 years, and we know that we have B12 reserves for 3 to 5 years. So 2 years is too early for B12 deficiency to develop due to the dietary deficiency. And if it's not diet that caused B12 deficiency, then most likely it's caused by absorption problems. And the most common pathology that disrupts the absorption of B12 is pernicious anemia, which is basically autoimmune gastritis. This pathology can be silent for years. Also, we have to know that one autoimmune disorder greatly increases the risk of the second one. So patients with autoimmune gastritis have a higher chances of autoimmune hypothyroidism or vitiligo. So if you see in tests macrocytic anemia and vitiligo, it's most likely pernicious anemia.